It's the Neighborhood Connect Show. 3, 2, 1, let's go. Joyce and Paul are an antidote.
Katsukian.
Here we go. It's the Neighborhood Connect Show.
This is Neighborhood Connect. We're here live at the National Civil Rights Museum. I am one of your co-hosts, Paul Young, Director of Housing and Community Development. And with me, I have the illustrious Joyce Cox.
Oh, I love the way you say that.
Well, glad to be here with you today, Joyce. And we have a special guest, Dr. Alisa HausHalter from the Shelby County Health Department is here with us today to talk about some of the things going on in the health department and some work that we have in common around green and healthy homes. So excited to have this conversation with you today. Before we dive into the conversation about what all is happening, I think it'd be great if you could just introduce yourself to the listeners. I know that a lot of people have met you, but some haven't. So it'd be good to hear a little bit about your background before you came into this role.
Thank you. And first I want to say I'm really excited to be here and appreciate the opportunity to be here with you and talk about public health and healthy homes. A little bit about my background. I'm a nurse by training. I started out as a district nurse or field nurse, which means that I visited people in their homes. So that's one of the reasons healthy homes are really important to me. For about 15 years in Nashville, did everything within that neighborhood. From seeing new babies to seeing older people, and then spent a significant number of other years what we call back in the building, which means leading programs, anything from violence prevention work as well as all of our community-based health improvement work in Nashville, and retired from there as what we call bureau chief, so had responsibility for a lot of different areas, including HIV and TB, as well as health promotion. And I ended my career really leading a stimulus award, which I'm always very excited to talk about. That was pre-Affordable Care Act, and that allowed us to really focus on healthy communities.
That's great.
Yeah, well, Paul, we finally stole somebody from Nashville.
Right. We love it when it happens that way.
Yes.
And I love Memphis, and I love being here.
Well, Memphis is a great city, and we're excited to have you as part of our city and leading important efforts on behalf of this city and county, might I add. So why don't you tell us a little bit about some of the things that are priority areas for the health department today?
I'm going to start with our new building, because anybody who has been to the health department knows that our building is older, outdated, and not necessarily customer friendly, and we have serious parking problems. We're going to break ground this summer for a new building, and the design of the building is very customer friendly. We will have parking spaces for our customers, so it really changes our focus to be focused on the customer and assuring that we have a welcoming environment to anyone who comes in our health department. And then over the last couple years, we've been trying to focus very heavily on better service, and we'll continue to do that as well. If we talk about some of the major health issues that we're facing in our community, I think many of you are aware of what those are, but the one I'll speak to first is the opioid crisis, because that's getting a lot of press currently. While we have less deaths and overdoses in Shelby County than the rest of the state, we still have a significant and rising problem, and it's important that we address that problem now and not wait for it to get as severe as some others. We have seen reductions in those numbers of individuals who go on to have AIDS, but we still have HIV transmission, particularly amongst young people, so that's an issue that we still need to address in our community particularly. And we have significant issues related to being overweight or obese. Critical issue, I will say, is poverty. And how poverty impacts living conditions, community conditions, and health outcomes.
And I think that's part of, obviously, that's the significant challenge that we deal with as a community. And when we talk about green and healthy homes, I think that is really at the core of part of what we want to address. We want to figure out how can we make it a more seamless system of support. We have so many different programs that range from programs that you manage through the health department. You have programs that we have in HCD and Shelby County Housing and through MLGW and TVA. The hospitals have a impetus to support outcomes, better outcomes for their clients that come to see them. And so with Green and Healthy Homes, that's an effort for us to all streamline the resources that we have available so that we can have a more significant impact on those families. So I know that you and I have gotten a chance to travel a little bit and talk about this nationally. And it's been a pleasure getting to tap into your mind on these important issues.
Well, it sounds like it's a holistic approach to just health.
Definitely.
Yeah.
And, when we think of health and public health, it's not any different than anyone else.
Exactly.
It's body, mind, and spirit.
Mm-hmm.
It's also emotional well-being, and all of that is linked back to someone's home.
Yeah.
But also linked back, I'll mention poverty again, it's really linked back to whether or not people have equal opportunity to be successful and achieve positive health, and that begins within one's home and one's community. So I'm glad to work with Paul and others who are leading efforts to really impact change in our community for the positive, to assure that everyone, particularly children, have an opportunity to achieve.
This is Neighborhood Connect podcast, and we are live at the National Civil Rights Museum. It's a taste of Memphis time. Neighborhoods commemorating MLK 50.
Friday, April 6th from 5 to 10 p.m. at Tiger Lane. We will have entertainment, food trucks, children activities, Cirque Rodeo, and neighborhood booths displaying their greatness.
A taste of Memphis time, Friday, April 6th from 5 to 10 p.m. at Tiger Lane. For more info, go to memphishcd.org or call 901-636-6986.
And it's gonna be the bomb diggity.
DC of that funky politics fame, we got a brand new show. It's called The Best in Blue. Will cover your Memphis Police Department and how they work to keep us safe day and night. Best in Blue on the Kazukian Network.
Neighborhood Connect.
This is the Neighborhood Connect podcast show at the National Civil Rights Museum, and we have Dr. HausHalter with us, and we were just talking about the opioid
Epidemic?
epidemic. Exactly. So tell me a little bit more about it. I'm a mother of a 23-year-old. So when Facebook started, he asked me, Mom, why are you on Facebook? And I said, because here's the end thing to do, and I want to keep up with you. So tell us a little bit more about the epidemic.
I generally start by reminding people we have had a challenge with opiates, heroin, in this country since after the Civil War. And we all need to recognize that. People have used heroin and other substances for different reasons and become addicted to those over time. So people often say, well, what's the issue now? Because we've always had a problem. What's happened over the last decade or a little bit more than a decade really has to do with prescription drugs that are synthetic opioids. So opiates are those things that are naturally occurring that come from the poppy plant, which would be things like heroin that we're familiar with. But pharmaceutical companies, in an effort to really assure that people who had serious pain, like pain from cancer, were able to get adequate treatment, developed a whole line of synthetic opioids that were used primarily for individuals who had extreme pain or in the hospital setting. Those have now spread out to the street market. They are highly addictive. More research has been done, and we recognize that individuals can become addicted to those in sometimes as little as 3 to 4 days. And as a result of that and prescribing patterns and really a national push to providers to assure that patients are pain-free, we went into this pattern U.S.-wide across our country of over-prescribing these drugs. Then sort of like, they're highly addictive, so we've got to take them off the market. Business-minded people do business things. Right. So then these drugs began to be made synthetically in other countries and brought to our country. And people who could not access the pills any longer went to heroin because heroin is less expensive. We now have fentanyl, which is highly deadly, available on the market. Much of that is made elsewhere and brought into the United States. It's sold very inexpensively. And oftentimes it's laced into other drugs, so that when we look at deaths in Shelby County, oftentimes people have multiple drugs on board, and fentanyl's been a big component of that. So it's a growing problem. It's now moved from prescriptions to the illegal market, and it's a combination really of a public health issue and a law enforcement issue.
So I have a question on that. I mean, I've heard that this issue is not as much of an issue in the black community as it is in the white community, and you're an expert. So what I've heard is just hearsay on Facebook and social media. Yeah. What are the differences along racial lines, particularly as it relates to Memphis and the rest of the state?
So I'll speak specifically to Shelby County more broadly, and I want to start out with saying there's really no community in Shelby County that's not affected.
Wow.
Every community, all races, all ethnicities are impacted in some way. When you look at the raw numbers, we have more white people who are impacted or ultimately have an overdose or a death related. But when we look at the trend line, so what that is how quickly it's rising in a given community, the trend line is actually much higher in the African American community. What that says to us is now it's trending upward, and that we're going to anticipate more deaths. And the one thing we keep saying in the health department, but also in other areas, is we have less deaths than East Tennessee and Middle Tennessee. We don't want to become like Middle Tennessee or East Tennessee. We really want to intervene early, and that's in all communities, including communities of color.
Right.
So what are some of the strategies, or are there any, to combat this problem?
It's a great question. The strategies have to be comprehensive and integrated. Mm-hmm. There has to be a public health approach, which is more about prevention. Okay. What we know is that oftentimes people who become addicted to substances have experimented in their teen years, and they had access in their own home or in a family member's home. So we really encourage people, one, don't get a prescription if you don't need it. Take it as prescribed, but then get rid of it, dispose of it when it's no longer needed. What we've been saying is count it, lock it, and drop it. So count your medicines, know what you have available, keep them locked up and away from others. It's not just youth who may come in your house, but it may be someone comes in to do a house repair. Mm-hmm. People will go through medicine cabinets to be able to access drugs, and then to drop those in a pre-identified location where you can dispose of those. We actually have those on our website, so you can always go to Shelby TN Health, and you can look up where those drop sites are. Within the treatment community, there are a lot of focuses on physicians and other healthcare providers to stop over-prescribing.
Okay.
But also we have to help people understand there's other ways to manage pain, and we have to challenge the health insurance industry or payers to pay for alternate ways to manage pain, things like physical therapy, occupational therapy, and so on and so forth. But then we also have to have a law enforcement approach to get the drugs off the streets. We can partner to do that. We're actually today looking at something called overdose mapping at the health department, where we will know real time where an overdose occurs. That allows us to get a team to help people get into treatment, but it also allows law enforcement to know where drugs are being sold so that they can stop the supply very quickly. And that's been successful in places like Baltimore or Pittsburgh, where they have had a historic opioid problem, and that this has reduced deaths over time in those communities.
Well, I like that. Count it, lock it, and drop it.
Yes.
This is the Neighborhood Connect podcast. We're here live at the National Civil Rights Museum with Dr. HausHalter, So we wanted to have you here to talk about green and healthy homes, and so I'm going to transition back to that. But this is so interesting on this opioid issue, and
I'm happy to come back.
Please do, and also remember on Kudzuki, and there's the Funky Politics show that I'm sure that Larry and his team would be glad to have you on.
Which I've loved to be on that. I always love to be on that show.
Yeah, they get pretty deep on that show, so you should be nervous about that one. But I want to transition back to green and healthy homes and talk to you about a little bit about what draws you and the health department into this conversation. What makes you believe that this is something that's important for our community to focus on, and what is it?
Well, Green and Healthy Homes Initiative is pretty much what it says. It's really promoting that everyone have an opportunity to a healthy home environment. In public health, we know that health starts at home. We treat people once they're ill. We try to promote healthy living, but we know the truth of it is where someone lives is what has a significant impact on their health behaviors and their health outcomes long term. If you look at public health historically, public health is really a social justice entity. So we have a responsibility to elevate those things or conditions that impact health. And housing, poor housing stock, the impact of housing on one's income or relative income is a significant social justice issue. And so it's important that we partner with people like you to elevate the issue and make a difference in our community.
So some of those conditions would be what, like lead and how we do our weatherization program at HCD. Do those have an impact in this particular initiative?
So that's one. I actually look at it very broadly from birth to death or crib to cradle, as they say. There's significant things that impact health. So lead is one. We know that it has a particular impact on children and their ability to learn and the impact on their behavior over time. Housing that has older paint, 1978 and before, obviously there's a problem. Lead can also be in water and pipes, and those are things that are going to impact our children's ability to learn and be successful as adults. There can also be things like overcrowding, whether or not there's a crib in the home. So we still have a high infant mortality rate in our community, and we promote children sleeping alone in the bed, so the ABCs of safe sleep. So we want to make sure that in that home itself there's also things that are not causing injury. For seniors, there's issues around trip and fall hazards, which impact. And then clearly, because we're in a place where we have a lot of moisture and heat, we have a lot of mold. And those are things that impact asthma, COPD, and other illnesses. And then I always have to talk about vectors because I'm in public health. So things like rodents, cockroaches, other things can impact health outcomes as well.
So you mentioned the ABCs of health. What is ABC?
ABCs of sleep.
Of sleep.
So yes, a baby should sleep alone in a bed in their crib. So.
Okay, alone in the bed in the crib.
Yes.
Okay. Alone bed crib.
Yeah.
Gotcha.
So how can the community help your neighbors? How can they help to be a part of this or have an impact on Green and Healthy Homes initiatives?
I would say several things. One, within your own home, people need to be aware.
Right.
And what are the resources available to them? What was mentioned earlier was we need to integrate these services. We have a lot of different services available, but community doesn't necessarily know where those services are or how to access. So that's what we're working on to make things more accessible, more seamless. So one should know that for themselves, but also for their neighbors.
Right.
The other is, volunteering to help. All of us have the ability to volunteer, and so I would say things like Habitat for Humanity that does significant work in communities. How do we volunteer with an agency like that may be able to support and help someone in one's community?
So I think we should also note that there are a number of partners that have come together to align to make this effort a reality for the city of Memphis, and Green and Healthy Homes Initiative is actually an organization that's based out of Baltimore. That's going to be working with us to help lead it. LaBonner has played a significant role in helping to rally the troops, so to speak. They've been playing a big leadership role in pulling a lot of this together. And there are countless other agencies. I don't want to start saying names, but the city, county, nonprofits, TVA, MLGW, Habitat for Humanity, a number of other agencies are all committed to making sure that our residents have an opportunity to live in healthier housing that's more energy efficient, which also speaks to some of the issues around poverty and how we can save money. So we're coming towards the end of this episode, and I wanted to see if there was anything else that you had to add. We could talk to you for hours, and I think we're treasured to have you in this city and county.
Well, I appreciate being here and appreciate the opportunity to partner. Given where we're located and given that MLK 50 is right around the corner, there's a quote from Martin Luther King Jr. that I like to use as a public health person, so I want to end with that if you don't mind. And I am going to read it to make sure I don't mess it up. Of all forms of inequality, injustice in health care is the most inhumane. And I would say not just health care, but health in general. And that we really have to think of our responsibility to each other to create a humane community and assure that everyone has an equal opportunity to be healthy and achieve their fullest potential.
Well, we thank you for being a part of the Neighborhood Connect podcast show with Director Young and myself. And it has been a pleasure listening to you and talking to you. And we really want to find out more information about the Green and Healthy Homes Initiative. Is there a website that our listeners could go to just get some information?
To keep it simple, they can Google Green and Healthy Homes Initiative. It'll take them to the Baltimore site, and that will give all kinds of information on healthy homes.
I'm Paul Young, here with Joyce Cox and Dr. HausHalter. We'd like to thank you all for listening to Neighborhood Connect podcast, powered by the Kudzukian Network, here live at the National Civil Rights Museum. Thanks.
Neighborhood Connect. Executive producer Larry Robinson for Kudzukian. Neighborhood Connect is hosted by Paul Young and Joyce Cox. Recorded at the National Civil Rights Museum. Directed, produced, recorded, and distributed by Kudzukian.
It's a taste of Memphis time. Neighborhoods commemorating MLK 50.
Friday, April 6th from 5 to 10 p.m. at Tiger Lane. We will have entertainment, food trucks, children activities, Cert Rodeo, and neighborhood booths displaying their greatness.
A Taste of Memphis time, Friday, April 6th from 5 to 10 p.m. at Tiger Lane. For more info, go to memphishcd.org or call 901-636-6986.
And it's gonna be the bomb. Diggity!
Riffin' on jazz.
When two friends get together to kick it
about jazz, it's called Riffin' on Jazz.
Catch us riffing on jazz every week right here on your favorite broadcast or podcast platforms.
Riffin' on jazz on the Kudzukian Network.
Kudzukian.